Good morning, class. In line with the 1-month suspension of classes, I am uploading this video lecture for everyone. I know this is not the most convenient medium for discussion, but I hope we can all work together and make this work. I consider doing a YouTube live soon so you could ask questions and do clarifications. And now let's start with the lecture. The lecture is entitled Interpretation of Prescriptions and Medication Order. We start with Module 1 with a description of prescription and medication orders, its parts, and its purpose. Now let us first define what a prescription is. A prescription is an order for medication issued by a physician, dentist, veterinarian, or other properly licensed medical practitioner. So a prescription must be accurately and legibly prepared to identify the patient, the medication to be dispensed, and the mode of administration. We should avoid abbreviations when we write prescriptions or when the doctors write prescriptions. Again, what are the things that we consider? First, the patient, followed by the medication order, and lastly, the mode of administration. You should also remember these factors in doing a prescription. So now, let us first discuss the different considerations of doctors when they prescribe medications. So let's describe the different considerations of doctors. So the first consideration of the doctor is to evaluate and clearly define the patient's problem. Next, to specify the therapeutic objective. Next, select the appropriate drug therapy. Number 4, initiate therapy with appropriate details with consideration to non-pharmacologic therapies. And lastly, to give information, instructions, and warnings. So primarily, these are the different considerations of doctors when they prescribe medications. Now let's go back to the other people who plays an important role in filling a prescription. Now we go to the pharmacist. So a pharmacist is the bridge between doctor and patients who counsel and advise the patient to maximize the desired effects of the drug and minimize the untoward adverse effect of the drug. So what would be the basic duty of a pharmacist? Now let's go to the duty of the pharmacist. So a pharmacist is responsible primarily in checking the prescribed dose, the prescribed medication rather, filling the prescription, and counseling the patient. So what do we counsel our patient? We could explain the effect of the drug or the therapeutic effect of the drug, and also the adverse effects that could arise after taking those medications. So in this basic duty, when we get the prescription from the physician, dispensing the medication to the patient to ensure that patient don't receive wrong drugs. That's one of the first thing that we consider. Patient should not receive the wrong drug or take an incorrect dose of the medicine. Dispensing the wrong drugs or giving incorrect usage instructions can lead to a serious consequence to the patients, including deaths. That's why we have a very important role in filling a particular prescription. And lastly, administration to a particular patient. Administration could be done by the patient, specifically if he or she is an outpatient. But for the inpatients, a nurse also plays an important role in the administration, working hand in hand with pharmacists and doctors for the proper administration of the medication. Now, we go to the broad categories of prescription. There are two broad categories of prescription. The first one is those written for a single component or prefabricated product and not requiring compounding or admixture by the pharmacist. So, the first example that I will be showing you is an example of an ordinary prescription, which is under this first category. And the second one is the yellow prescription, which also falls under this category. The third one, or the third type of prescription, falls under the second category, which is those written for more than a single component and requiring compounding. So as you can see here, the drug is sildenafil 50 milligram tablet, but with a special instruction to give one paper tab every 6 hours. And paper tab, this is the compounded preparation. Compounded preparation. Now for the next one, okay, now we go to the different parts of the prescription. Why is it important for us to know the different parts of the prescription? Because it would be easier for us to intercept the error if we are able to acknowledge the different parts of the prescription. Okay? Now, let's start first with the patient's information. Patient require information to help them use their medicines safely and effectively, and to facilitate an understanding of the possible harms and benefits of the treatment. The details should have the patient's name. That should always coincide with the patient's age and the patient's sex. We need to always validate this information to know whether the medication stated in the prescription is for the patient that is written in the prescription. For example, if the name of the patient is Ada Atienza and the patient is 27 years old. If the prescription here states to give biogesic drops for fever, is it appropriate? Yes, you are correct. It is not appropriate with the age of the patient because as you can see here, drops are intended for who? Yes, for infants. Now, let's go to the next part of the prescription, which is the superscription. This is the RX symbol on the prescription form that designates the written document to be a prescription. RX is an abbreviation for the Latin phrase that says, take thou. So that's the meaning of the superscription. The next part that we will be discussing is the inscription. An inscription includes the drug name. So for this example, we have the ampicillin sulbactam unacin, the concentration, and the type of preparation or the dosage form. So, to have a complete inscription, the ideal things that should be seen in this prescription are generic name, brand name, dosage strength, and dosage form. If ever in the instance that only the generic name is written in the inscription, this prescription is still valid. But in the case that only brand name is stated, that's the time that we could ask the physician for the generic name of that particular brand to avoid error. Okay? So now, let's move on to the next part of the prescription, which is the subscription. The subscription, this one is the instruction to the pharmacist, usually consisting of a short sentence or represented by this number in this case. So this number sign, 21, means dispense 21 tablets. And as a mode of communication between pharmacists, these particular dates and this term is stated. So, why do we actually need to communicate with other pharmacists? So, in this case, you could see that on the first dispensing of the medication, only 15 tablets were dispensed last December 26. Meaning, the prescription is not yet fully served. So, on the next date, which is December 31, the patient bought all the remaining tablets that he or she needs. This FS means fully served. So, this prescription, after these two dispensing, which is the 15 and 6, the prescription is fully served. And once a prescription is fully served, that means that if the patient would go to another pharmacy, the pharmacist should not dispense this medication since the pharmacist already know through this communication that the prescription is fully served. Next, we also have the signa. If the subscription is the instruction to the pharmacist, the signa is the instruction for the patient as to how to take the prescription. But, let me just emphasize this, it is interpreted and transposed onto the prescription label by the pharmacist. So, meaning, if ever that the medications requires a label, the pharmacist should explain to the patient the signa given by the doctor. Or, if there are no label required and the medications are packed in blister packs, the pharmacist should still explain the signa to the patient so that the patient would understand what to do upon getting those medications. So, in this case, the signa is take 1 tablet 3 times a day for 7 days. Guys, you might observe that we are not using the abbreviation for the signa. This will lessen confusion and medication error. So the next type of prescription that we will be discussing is a yellow prescription. Unlike an ordinary prescription, yellow prescription could only be prescribed by medical practitioners, doctors, dentists, and veterinarians with valid S2 license granted by PDEA. This is usually issued in triplicate copies with specific direction of use. The original copy of the prescription will be surrendered to the drugstore, which dispense the drug. The duplicate copy will be a copy for the patient or the purchaser, and the triplicate copy will be retained by the prescribing practitioner. So, unlike your ordinary prescription, a yellow prescription has a specific number per each prescription to avoid duplication and reuse of the yellow prescription. Now, we will be discussing the different parts of a yellow prescription. The first thing that we will be discussing is the standard information to be supplied in the prescription. We need to have the full name, complete business address, telephone number or email address, current S2 license of the physician, and the validity of license is also important. So, it is also stated that the PRC license is needed, and on the lower part of the prescription, as we will be discussing this later on, the PTR of the doctor should also be included in this prescription. Other than that, the complete name of the patient, age, and complete address of the patient should also be in this prescription. Another important part of this prescription is the date of issuance of the prescription, because this will serve as the proof of validity. We should always check for the date that the prescription is prescribed, because there's a particular validity time that they could still use a prescription, whether ordinary or the yellow prescription. We also have inscription, subscription, and signa in a yellow prescription. But there are more strict implementation for a yellow prescription, unlike the typical ordinary prescription. So for a yellow prescription, generic and brand name of the preparation to be supplied, its dosage, strength, and form, and the total dosage units or total quantity of prescription to be supplied in words and its numerical equivalent. For the direction of use for the patient, the direction of use such as take as directed or take as required is not acceptable. Okay? And the inscription no refill at the face of the prescription and the original signature of the medical practitioner. But in the country, we do not have any refills for a yellow prescription, and there are only particular number prescribed for each prescription. On the lower part, you could see here the doctor's signature and the PTR number of the physician. Now let's go to the compounding prescription. In a compounding prescription, there is a direction for the pharmacist to prepare the medication in another dosage form suited for the patient. In this example, the patient is a pediatric patient which would most likely could not ingest a tablet, and the dose of the drug would be too high for the patient, that when we compound a suitable dosage form, or we are responsible in compounding a suitable dosage form with an ideal dosage strength for the patient. So in this case, since we cannot give the 50 milligram tablet to the patient, we are giving the patient a paper tab with a dose of 1.4 milligram. Now, I will be showing you an electronic health record. So what is an electronic health record? Electronic health record is a digital version of a patient's paper chart. EHRs are real-time, patient-centered records that make information available instantly and securely to authorized users. An EHR can contain a patient's medical history, diagnosis, medications, treatment plans, immunization dates, allergy, radiology images, and laboratory test results. Integrated electronic health information systems allows doctors, nurses, pharmacists, and other healthcare providers to appropriately access and securely share a patient's vital medical information electronically. Most of the electronic health records are kept as a hospital record of a patient, and all of these are confidential. Only the medical team would have an access on this one. Next one is electronic prescribing. In the recent rise of problems or medication-related problems, electronic prescribing was one of the media that is utilized now to prevent those type of errors. So what is an electronic prescribing system? This is a computer-to-computer transfer of prescription information between authorized prescribers, pharmacies, intermediaries, and payers under nationally accepted standards. So now, let us discuss the different advantages of e-prescription. First, again, as I said a while ago, it reduces prescription errors due to prescription legibility. One of the major problems that we are encountering now whenever we are reading prescription is when the doctor did not legibly write whether the inscription, which is consist of the generic name and brand name, and the dosage strength. If one of the parts of that inscription is not legibly written, we could have the tendency of error. Next is concurrent software screens for drug interaction, reduce incidences of altered or forged prescription. Another problem, specifically for the yellow prescription, since the drugs that are written in the yellow prescription are not dispensed if without a yellow prescription, some would take advantage if ever they would get a yellow prescription of writing a prescription for their own and forging the signatories in those prescriptions. And efficiency for both prescriber and pharmacist, and also convenience for the patient since they do not need to bring any prescription since this is a computer-to-computer transfer. Next one, we also have the medication order. A medication order is written directions provided by a prescribing practitioner for a specific medication to be administered to an individual. The prescribing practitioner may also give a medication order verbally to a licensed person such as pharmacist or a nurse. The information in medication order contains similar information that would be included in a prescription. So generally, meron din tong inscription, meron din tong subscription, meron din tong signa. Okay? Next one. This is an example of a typical order sheet. So let's have a checklist kung ano ba yung mga information that is the same with the prescription. Both of them has patient name, age or sex. So in this case, since this is an inpatient and most of the medication orders are given to inpatients, we also have the physician, the hospital number, the service, the room. So in this case, the difference between a prescription and a medication order, most of the medication order is not intended to be read by the patient. More on, for a medication order, this is intended to be read by either a pharmacist or a nurse. So for the instructions, it is completely stated here that, for example, we have propranolol 40 mg 4 times a day. Okay? So this is directed or instructed to the pharmacist or to the nurse. Another example of a compounded prescription order, in case that there is a need for PCA, TPN, or IV admixtures, they could write it on this prescription order, compounded prescription order. Now, prescription and medication order accuracy and verification. So, what are the first things that we need to do, or what are the step-by-step procedure in checking for a medication order? The first one is careful reading, followed by feeling, including the calculations. That's why pharmaceutical calculations is very important, because by the time that you will be in the practice, all the calculations, ang basis nito, PharmCal. Checking and dispensing of the prescription or medication order. The process often is enhanced by technologies as the computer matching of a drug package barcode with the prescription order and or by matching the barcode to patient's coded wristband in a patient care facility. Unfortunately, we do not have those kind of facility of barcoding. So, what could we do to check or validate? For the careful reading, therapeutically appropriate for the patient, the medication should be therapeutically appropriate for the patient. Prescribed the correct dose. You can check this one by doing calculations. Dispense in the correct strength and dosage form. This is when you could check for the importance of patient identification. Because you know if the dosage strength and the dosage form would be appropriate for the patient. Correctly labeled with complete instructions to the patient or the caregiver. Labeling the medication is important so that if the patient is an outpatient, they could take the medication correctly. For the patient in a hospital or other healthcare facility, each medication must be administered to the correct patient at the correct time, by the correct rate, and the route of administration. Those are some of the things that you should always remember. Again, you should have the correct patient, and the drug should be administered at the correct time, by the correct rate, and also route of administration. Now, you might be wondering why we are asking you to memorize or familiarize yourself with the different abbreviations. So, to be very honest, in the current practice of pharmacy, we are not utilizing abbreviations that often. So, abbreviation and symbols are common in prescription and medication order. Although they may save time for prescriber, it is sometimes the cause of confusion and can be misinterpreted, resulting to medication error. In the current practice of pharmacy, the physicians are not encouraged to write the signa and subscription in abbreviation form. This is just to avoid misinterpretation. Next one, the utilization of Roman numerals on prescription. As of now, we do not usually use this one, but for familiarity, I will just be discussing to you, or in case that we will be encountering this type of prescriptions, you would know how to read and interpret. So, used to designate quantities as the quantity of the medication to be dispensed or quantity of the medication to be taken by patients. These are the usual value of single numerals. We have SS for 1/2, capital letter I, small letter I or J means 1, capital letter V or small v means 5, capital letter X or small x means 10, capital letter L or small l means 50, capital C or small c means 100, capital letter D or small d means 500, and capital letter M or small m means 1,000. Capital or lowercase may be used dotting the lowercase or placement of a horizontal line above the letter I with the dot atop serves to avoid misinterpretation. So for this one, we usually put a dot, or sometimes this is represented by letter J. So in this example, this one is a triple letter X. So this means that in this prescription, you should dispense how many? X. Where's the letter X? How many per X? Okay, that's correct. 1X corresponds to number 10. So in this case, since this is a triple X, what is it? Yes, this one is 30. Now, let us do a recall on the following rules applied in Roman numerals. Number 1, a letter repeated once or more repeats its value. Just like yung example natin kanina, the 3-letter X is equals to 30. Next one, one or more letters placed after a letter of greater value increases the value of the greater letter. In this example, we have letter V and letter I. This becomes 6. Or XII, this becomes 12. Or LX, this becomes 60. Number 3, a letter placed before a letter of greater value decreases the value of the greater letter. So unlike the first one, if the letter I is first before the letter V, this becomes 4. Or XL, this becomes 40. And fourth or last rule in Roman numerals, use the simplest choice among. You might be wondering, nagkakaroon ba talaga tayo ng mga medication errors in prescriptions? Or are there instances na nagkakaroon ng death because of medication error? Now, I will be teaching you how to prevent error and omissions in the prescription. How? Let me just have this one article first before we discuss, okay? So, in this article, it is stated that 79% of the patients experience at least one error during medication period. Such error may cause patient to have ADR, aggravation of illness, or death. A simple ADR, such as anaphylactic reaction, could lead a patient to death. That's why simple medication errors should not be neglected. So as you can see here, patients should be aware in the prevalence of the medication errors, such as what are the usual errors that we encounter. First, we have frequency and timing, improper administration of medication, discrepancy in the dosage, and intake of the wrong drug, among the others. Let me just give you examples of these types of errors. Incorrect frequency. Okay? Rather than Frequency muna tayo. For example, the patient could not interpret BID. Okay? Or for example, ang akala ng pasyente natin, BID means 3 times a day. Since there is an additional dose, because this should be intended as 2, what could happen? In this error in frequency, the patient could have an overdosage. Next, we also have the timing. Timing is important for some medication, particularly drugs for diabetes. Drugs for diabetes, for example, should be administered before eating or after eating, and the proper timing should be observed. Or for antibiotics, to avoid the adverse effect, specifically gastric disturbances, you should take the medication at least an hour before or an hour after. Next one, we also have improper administration. Okay. So, this may sound funny to you, or you might be thinking that, is that even possible? But let me just share you one instance that is shared also by my professor in my MS Pharmacy degree, wherein one patient is diagnosed with a particular disease on the vagina. Okay? So, the prescription is a vaginal tablet. So, when we say vaginal tablet, this should be administered via vagina and not oral. So, in this case, my professor, who is also a pharmacist, was asked by one of the nurses, "Ma'am, what time should I administer the medication to the patient?" Okay? With the question of, "Ma'am, ipapainom ko po ba yung gamot ng gantong oras?" Ipapainom. And that is a vaginal tablet. So with that is a close, very, very, very close chance na magkakamali siya if nagpainom na sila, because that is intended to be a vaginal tablet. So in that case, the interception that was made by my professor was to give the proper administration of that particular medication. Discrepancy in dosages, this could happen in adults, specifically geriatrics and pediatrics, because the dosage should also be calculated. That's why, okay, children, tandaan nyo mabuti. When we do the calculation of doses, make sure that you are equipped so you would know the proper dispensing of those medications. Wrong drug. This wrong drug could happen specifically for patients who has an old age, okay, or matatanda na. Bakit? Ano po pwede mangyari sa kanila since they are old? The tendency would be they could interchange their medication. So such lapses in medications are caused by 3 factors. First, poor communication between healthcare providers. Okay? Just like yung example ko sa inyo a while ago. If hindi nagtanong si nurse dun sa professor ko, that vaginal tablet might be administered orally to the patient. This happens when a patient visits healthcare providers but does not inform the new provider of his medication history. Secondly, medication error also happen when physician does not clearly make his patient understand the prescribed medication. And lastly, there are medication names and medical abbreviations that sound alike, causing confusion and incorrect usage. So that's why we prevent using those abbreviations. Now, this one states that this report says medical errors such as indecipherable prescription caused the deaths of 98 patients a year. Or is that 98,000? It's hard to read this. In any case, we're supposed to report them or not repeat them. Now, in this particular comic, you could see indecipherable prescription. Since since we already discussed some of the examples of prescription, when we say indecipherable, yung legibility of the prescription is given consideration on this part. As I said a while ago, a prescription should always be legible. Because if it's not legible, the problem would most likely be wrong dispensing of medication. So what are the things that we need to check for us to prevent these errors and omissions? One, prescriber's information. If you could actually get the address and number of the physician, it would be a lot better. Next, you should check for PTR number, PRC number, and in case of yellow prescription, the Drug Enforcement Agency number of that prescription. Next, date of the order and its currency to the request or filling. 4. Patient's identification information. Or if it's applicable for the dose determination, you should check for patient's age, weight, or other applicable parameters. 5, drug prescribed, including dose, preparation strength, dosage form, and quantity. 6, clarity of any abbreviations, symbols, and or unit of measure. Clarity and completeness of directions, directions or use. And if there's a need for special labeling, you should check. Special labeling or auxiliary labels. And if it's compounding, listing of all the ingredients. Now, for medication scheduling and patient compliance, frequency, times per day, and duration of length of the drugs prescribed or recommended use should be specified. Why is it important to know the frequency? Because a frequency is important for the efficacy and at the same time the adverse effect. Too much intake of the medication could cause the adverse effect, and at the same time, kapag kulang naman ang pag-take ng medication, that could cause underdosage. The duration is important because specifically for antibiotics, if it's stated that it should be taken for 2 weeks, then the patient should take it for 2 weeks. So patient compliance, patient understanding and adherence to the direction of use. A patient who does not understand how to take the medication would resort to not taking the medication at all. That's why for patient compliance, it's important that you clearly discussed the use of the medication. For the patient non-compliance, failure to comply with the practitioner's or label direction in self-administration of any medication. For the non-compliance, one problem that usually arises on this one falls under the category F for adverse drug effect or failure of efficacy. For one reason that non-compliance, we do not have a power over the patient, or we will not have the knowledge if the patient is taking the medication, specifically if the patient is outpatient. So, what could happen if the patient is non-compliant to the medication? The problem is either underdosage or overdosage. Some patient who tends to self-medicate would resort to taking the medication more than what is prescribed kasi ang thinking ng mga pasyente, mas gagaling ako pag mas madami akong ininom na gamot. On the other hand naman, another mentality is, I would not take this medication. Sinasabi nga ng mga nakakatanda, magdadahon-dahon na lang ako para sa gamot. Okay? But the problem with that is, there is no guarantee in those herbal preparations that could relieve or give cure to that particular patient. So, nag-underdosage sila. Minsan, hindi sila nag-take ng gamot at all. Inconsistent and sporadic dosing, incorrect duration of treatment. Dito, guys, ang nakakatakot na incorrect duration of treatment is TB. Kasi bakit? Usually, 3 months to 6 months sana ang tuberculosis na treatment. So, dito ngayon, kapag nagkaroon ng patient non-compliance ZAN, the problem would most probably be magre-recur lang rin yung tuberculosis. And drug abuse with medication. Drug abuse, this one is for drugs and drugs that needs yellow prescription. Most of the drugs that needs yellow prescription, the problem is these are habitual drugs. Kaya nga hanggang ngayon, wala pa ring approval for marijuana or hindi pa entirely accepted that marijuana could be a medication. Kasi nga, the problem is, marijuana is one of the most abused drug. Okay? Kaya talagang dito tinitingnan din natin yung for drug abuse. Next one, factors resulting to non-compliance. Unclear or misunderstood direction. A patient who does not understand what to do would resort on not doing or taking those medication. Specifically, drugs with medical devices. Undesired effects of the drug that discourage the use. Guys, dito sa part na to, yung undesired effects, we could explain to the patient that those effects are part of the treatment regimen. For example, that is only a side effect and won't affect the use or the indication of the medication. And if it's tolerable, they could still continue with the medication. Lack of patient confidence in the drug or the prescriber. Kaya nga lagi sinasabi natin, the patient should trust the pharmacist, the patient should trust the doctor. Because once the patient is in doubt in any of the healthcare providers, they would not take this medication. Discontinued use because the patient feels better or worse. This is our first enemy for antimicrobial resistance. What would be the problem? Once the patient feels better after 3 days, they would stop taking the antibiotics. So the next time that they would have the same disease, that particular antibiotic will have no effect at all. Economic reasons. Under the generics law of the Philippines, which is a law that helps the poor also, this states that medications could be taken irregardless of the brand name. For economic reasons, some of the patients could not take the medication. Why? Because they do not have the knowledge that they could have an alternative for the medication prescribed to them. Most of the generic drugs nowadays is a lot more cheaper and therapeutically equivalent. So this one, we could do something about this particular problem. Absence of patient counseling. In the counseling session, this is where we give direction to the patient. So, if the patient could not understand the prescription, it is our responsibility to explain it in the counseling. So, if we fail to do counseling and the patient fails to understand the direction, they would not take the medication. Confusion over taking multiple medication. For adults, for adults, specifically geriatrics, the first thing that we could do for this one is to give pill tabs, okay? Or pill containers for our adults, such with labels of their medication with the day and time that they will be taking. Or they should be guided by a younger person or a caregiver or a nurse for their medication, and a lot more. So what will be the consequences? Of course, worsening of the condition, requirement of additional and more expensive or more extensive treatment, and increased total healthcare cost. So now, answer the portion in your book. Sorry, I am not sure if we are utilizing the same book because as of now, I am utilizing an ebook. Answer the questions for the interpretation of abbreviations only. Write it in your assignment or CTwork notebook. Kindly check if it's page 69 or basta yun. Kindly check lang the portion of the interpretation of those abbreviations. And next meeting or meeting after the discussion or the YouTube live, I will be posting our very first online quiz. So our next topic is computation for the prescription orders, which I will be discussing on the next video.